I'm Diane Vu. I'm an Assistant Special Agent in charge with the U.S. Department of Health and Human Services, Office of Inspector General, Office of Investigation in Los Angeles, California. My first experience with formal education was at the age of 10 when I immigrated to the U.S. I was born in Vietnam and had little to no formal education until I found myself enrolled in 5th grade in a public school in the U.S. My parents lacked the knowledge and language skills to assist and navigate my education, so I learned to navigate my education system on my own. In my family, education was valued and viewed as a path out of poverty, so I worked really hard in school. I remember getting my first job at 15 and a half while in high school. After 8 years of being in the US, I enrolled at Cal State University, Fullerton, and I graduated with a bachelor's degree in political science. I chose a local college to save money and live at home with my parents. I studied political science because I love how our democracy operated. People can vote for who they want, and their representatives can pass laws that are the will of the majority. I went on to graduate school at Chapman University and obtained a master's in criminal justice. After graduate school, I took a job with an insurance company, but felt unfulfilled. Ultimately, my heart was in public service, and I knew I needed to follow my heart. I could not think of a more rewarding work than public service. I focused all my efforts in obtaining a public service job, and I became a peace officer for the state of California, Department of Motor Vehicles, Office of Investigation. While I was working at the DMV, I received a call from an HHS OIG special agent requesting assistance on a case pertaining to the identity theft of a doctor. I assisted the special agent on his ongoing investigation and learned so much about the organization. I was so impressed with HHS OIG's mission and core values that I applied. I chose OIG because OIG's main mission is to protect the most vulnerable population from fraud, waste, and abuse. I can't imagine a more rewarding and fulfilling work. There is really no typical day. I'm an ASAC at a federal law enforcement agency. Every day is different challenges, different possibilities. I can't say I'm ever bored. The key to a successful day is simply being available to handle everything and anything that comes my way. I am motivated to make things better than how I found them. However little my contribution may be, I want to be part of the solution. HHS program touches so many Americans, the elderly, the disabled, the lower income, our most underserved communities. Where there's fraud, waste, and abuse to these safeguard programs, it really troubles me. Fraud or abuse, whether intentional or done in error, needs to be addressed and corrected. The OIG is in the perfect position to identify, make recommendation, and rectify the problem, and return the money back to the Medicare Trust Fund for proper distribution. Every day, I wake up knowing that I can make a difference in the lives of my fellow Americans. I know I have an impact on every American, whether they know it or not. Having an immigrant background makes me appreciate people of all colors, gender, religions, and lived experiences. In my job, my agents are diverse and bring a wealth range of experiences to the table. Our cases require us to connect with Medicare or Medicaid recipients. When we are diverse, we can serve them better. The Medi perspective and viewpoint on investigation guarantees that we do not miss anything. Co-workers who are different from you will bring ideas that you may have not thought of and can open discussions that could be missed. Medicaid is the national's main public health insurance program for people with low income and disability, regardless of age. It is the largest source of public health coverage in the United States, covering nearly 70 million Americans. Individual states administer their own Medicaid program with federal requirements and contribution. Together, Medicare and Medicaid programs provide healthcare services to the American, both nationally and locally, and I'm proud to be a part of such a wonderful organization. My advice to all the young people looking to work in public sector is to put yourself out there, to attend those public service and government career fairs, to talk to your career development center at your school, and really to start a resume on usajobs.gov. Check out your state websites for openings, apply for those presidential management fellows and internships, Connect with your community leaders. The key is to start building your network now and getting the support, getting your foot in the door in any government organization, and work from the ground up. The government has all levels and are always hiring. Good luck, and I promise you it will be a very rewarding career. Thank you for allowing me to share my story.